Well, good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. Thank you. We appreciate everyone for being with us here this morning on Facebook. Now, this morning we will have an update from Spokane County Health Officer Dr. Bob Lutz. Any questions you may have for the doctor, please share them with us here on Facebook. We'll try to get to as many as we can here this morning. And we'll begin with Dr. Lutz.
Good morning. So hope you had a great weekend. It was good weather. I actually got out in my backyard and did some landscaping for the first time in a couple of weeks. When I was sitting on my front porch, I saw a number of neighbors walking by with their dogs, all appropriately physically distanced, and so I was really appreciative of that. Also saw people in the park. I really appreciate your consistent efforts to address the physical distancing challenges that we have been dealing with. So people are looking for numbers, and the first slide. Recognizing that these are yesterday's data, I can tell you that over the weekend we saw an additional 15 cases, so we have 313 total cases, and we have 59 hospitalizations over the course of the illness, and 17 deaths, so we've had no recent deaths over the last few days, which is very reassuring. Just go to the next, yeah. So again, hospitalization. So you can definitely see the downward trend, which I'm very encouraged by. We've talked over the last few weeks of being at risk. Well, what exactly is at risk mean? Who is at risk? And so typically we talk about individuals who are over the age of 60 to 65. The reason being oftentimes they have other medical conditions, and then those medical conditions, so be they heart disease, lung disease, what we call COPD, those are again risk factors for COVID-19. We also know that people who have a compromised immune system, maybe they have chronic medications that they're on, such as steroids, or what we call immune modulating medications for different types of arthritis. Those are also individuals who are at increased risk. Other illnesses that include things like poorly controlled diabetes or end-stage renal disease. And interestingly enough, there are some recent data that have suggested that pregnancy may be a risk factor for contracting the illness. So these are what we call risk factors. By no means does it mean that you will get the illness, but nonetheless, meaning that if you fit any of those criteria, we do really recommend that you focus on all of those recommendations that we have been talking about over the past few weeks. Now, this leads me into the next conversation, and specifically about lung disease and also about smoking and vaping. Now, you may remember a number of months ago, the vaping issue was the big epidemic that we were addressing, especially with young people. Vaping hasn't gone away. Although vaping stores are not considered an essential business, vaping still happens, and we know that smoking still occurs. Not surprisingly, smoking and vaping both damage the lungs, and therefore it's not surprising to learn that there are studies that suggest that smoking is a risk factor for COVID-19 infection. It's also therefore a risk factor for worsening infections. We do not have data specific to vaping at this point, but nonetheless, one can assume that if smoking impacts the lung, we know that vaping does. If smoking increases your risk for COVID-19, then vaping would do as well. When I speak about vaping, I'm not only talking about nicotine-based products, but I'm also talking about cannabis-based products. We know that vaping, irrespective of what is being vaped, is damaging to the lungs. And if we look at, for example, risk factors for influenza during the flu season, tobacco usage is one, vaping can be. And so I think that it's really important to emphasize, and although this may not be relevant for you as a listener, maybe you have grandkids, maybe you have kids who are vaping, who may have turned to vaping rather than smoking. Really, as much as you can, it's a great time to discourage them from these practices, because we know that smoking is the leading preventable cause of illness in our country and around the world, and it can be something that may increase your risk for COVID-19. So now's as good a time as any to either quit smoking or quit vaping. There are lots of resources out there. The Regional Health District has information available to it. There's a site called donemyway.org. And for those of you who like to text vape free Washington, I'm sorry, vape free WA. I'm not a texter, as you can tell. So VAPEFREEWA for information along those lines. And I think I would just like to end with the important message of staying true to the stay home, stay healthy message. As I mentioned over the weekend, it was great to see people in my neighborhood who were doing all of those physical distancing recommendations, and it's tough, I acknowledge that. It was also wonderful to see people in the park, but I also saw people in the park who weren't. And for me, that's a concern because this is a message that needs to be taken home. I really can't emphasize enough. It's tough, I acknowledge that, but the metaphor that I've used before is like opening a door and you're not quite sure what's behind the door. If you don't like what's behind the door, you're going to have to really close it shut very, very quickly. I think as we talk about reopening the community, reopening the state, reopening the country, it needs to be done very, very cautiously. Because again, I do not want to find us back where we were just a few weeks ago, amazingly just a few weeks ago. So with that, I'll end my message and take it to questions.
And we do have a few questions from viewers already. One specific one we just got: are there required milestones or criteria for reverse in the state stay-at-home order?
So with respect to criteria, or what we are sometimes referring to as metrics, they have not been defined with specifics as of yet. So we are looking at things, for example, what is the total case rate, the new case rate? What is the hospitalization rate? Are we seeing downward turns? What is the overall number of individuals who are currently hospitalized for COVID-19? This speaks once again to the important issue about testing. We have talked about this many, many times in the past. You will continue to hear me talk about it in the future. Going forward, we will need to have resources available to do robust testing. There'll be new guidance coming out this week to healthcare professionals that will be talking about the importance of testing anybody, I emphasize, who has symptoms that are suggestive of COVID-19. So where in the past we were very restrictive about saying fever or cough or shortness of breath, we also know that people are presenting with sore throat, with aches and pains that may seem a lot like flu. And so the new guidance that will be coming out from the Department of Health this week is that for providers, for healthcare professionals, or for you as individuals, if you have any symptoms that are suggestive of COVID-19, you should be tested. And so that is part of the strategy to really move forward and open up the economy, open up Washington State for everyone.
Dr. Lutz, you'd mentioned briefly that pregnancy was thought of as a risk factor, and possibly there's more information coming out about that, but could you share with us what you know about pregnancy being a risk factor during a COVID-19?
Sure. Yeah. So around pregnancy, this is sort of some new information. There was an article that came out, I want to say, in the New England Journal about 2 weeks ago. And so there's been some chatter across the medical community because we know oftentimes that pregnancy is considered a challenging time in a woman's life that may make her more susceptible to a number of issues. Not surprisingly, if we say that it may affect the immune system and the immune response, pregnancy may be, and I emphasize may be, a risk factor. So there has been some data that have suggested that women who are about to deliver, if they are tested, they may be asymptomatic, but they may test positive. So I believe that in the coming weeks and months, we may see that recommendation that women who are about to give birth are tested for COVID-19. By no means is it a guideline right now, but I think there is enough information that is coming out that suggests that may be something that we see in the coming weeks.
Now, for nearly a week now, Spokane County has not recorded a new death. We've stayed level at 17. What are your thoughts on that?
cautiously optimistic. Again, I think that I am happy to say that. Believe you me, I am very happy to say that we haven't seen more deaths due to COVID-19. We continue to see gradual increases, but certainly not increases in the case numbers that we saw at one point in time. So I think that's encouraging. I do, however, note that, as I mentioned to you before, those at-risk groups, I was on a conference call over the weekend and just talking with clinicians who are taking care of individuals with COVID-19, hospitalized individuals with COVID-19, it's very serious. And so I think all of the efforts that we're doing at physical distancing, at, again, lots of hand washing, not touching surfaces, ensuring that if you touch a surface, you're hand washing, I think those are making a difference. And I believe that is why we're seeing fewer cases overall and fewer deaths.
We have another viewer wanting to know if there's a correlation between the weather and the possible effects on the virus.
Yeah, so one, oftentimes, there's definitely you see more colds. You see more colds during cold months in temperate climates, and it may be a function of the fact that those viruses are more common and or people tend to be around other people more commonly during the winter months. There has been some hope that this coronavirus, this cold virus, could actually decrease during the summer months. We have not seen that, to the best of my knowledge, as of yet. So as I said, we would like to think that may be the case, but we've not seen it to date. We do know, however, that the coronavirus is very susceptible to UV light, and that is a means by which, for example, some organizations are reusing their personal protective equipment by using UV light. So UV light can be something that helps sterilize, but it doesn't necessarily mean that because there's more sunshine that we're going to have less COVID-19 infection.
And another viewer curious as to a term and something we've been talking about for probably a solid week now when it comes to antibodies and antibody testing. Can you explain kind of where we're at with that?
Yeah, certainly. So the testing strategy currently is to identify individuals who have infection. And by far and away, the means we have been using for that, I won't belabor the technical term, but it's called PCR for short. We're looking at a new type of testing called antibody tests. So when your body is exposed to an infection and it's able to mount an immune response, it makes antibodies. So there are a number of tests, more than 80, that have been submitted to the FDA for evaluation. During this emergency process, those tests have been, if you will, fast-tracked. They have not been approved by the FDA. Currently, there's only a single FDA-approved antibody test that is only available right now to clinical laboratories. We want to understand the COVID-19 infection and specifically two elements of this antibody response. First of all, what level of antibody response is necessary to provide immunity, and then how long will that immunity last? So those are two questions which we do not know, and until we have those answers, we're really cautious about making antibody tests available. Why? Because you may be able to get an antibody test. You may be told that you are quote unquote immune based upon a number, and that number may be meaningless because it doesn't mean that you have enough of an antibody response to actually fight off the infection and or to suggest that you were purely cured of the infection. False sense of security. And so while it remains something that looks very promising, right now it is not something that I support, but again, stay tuned.
I apologize if this is in the similar realm, but I've seen reports of individuals who have recovered from COVID-19 and are now donating plasma. Is that in the same realm of what you were talking about, or is that promising in your world?
So the idea about what's called convalescent serum. And so, as I mentioned, when somebody recovers from an infection, the body has made immune cells and made antibodies to it. And so the idea is that you take off the plasma from an individual who has recovered, and you're then able to use some of that plasma to give to somebody who may be infected. It is still very experimental. You have a number of clinics and hospitals across the country that are using it in some limited capacity. It's something that goes back a century. It's been used in a variety of viral infections. It was used during the pandemic of 1918. It's been used in a variety of other infections. The most recent one that I remember, and recent is, again, many, many years ago, decades ago, diphtheria. So it's been used in the past for viral and bacterial infections. It's being investigated. There are some trials, but by no means is it currently available across the board. There have been requests, I've seen this in New York City, however, where people have been able to donate convalescent serum, and in those situations, such as in New York, where there have been really high volumes, high numbers of people who are seriously ill, it has been used with variable success. So it's something to consider. It's something related at some level to the antibodies, but again, somewhat different.
And finally, this morning, this will be our final question. We're expected to hit 70 degrees today, possibly tomorrow as well. A lot of people out there have been at home for the last few weeks doing exactly what we've been asking of them. Now starting to venture out maybe a little bit more. You're going to get people out there as well. Also people out at stores wanting to start planting flowers, wanting to start planting those gardens right now. What would your suggestion to folks be as we get into some of the warmer temperatures we've seen in a while?
Yeah, it's actually funny. My wife went to order seeds last week, and she found that all of the seed companies have sold out across the country. And so we were really challenged to buy seeds. So she was able to find some, and we have some beans that we're planting, just an aside. And we actually did go out and do a little bit of gardening this weekend. You know, again, I come back to the same message. You can be outside, you can be out and enjoying the sun and getting that UV light and gardening, but do so with practicing all of those things that we've been talking about. The physical distancing. If you're out, wear a mask. Because again, you may be symptomatic or asymptomatic, excuse me, you may be asymptomatic and could potentially affect somebody else. When you're out in those stores, when you're gardening, when you're going to any of those places to buy seeds or to buy plants, maintain that physical distancing guidelines. Those, again, have been shown. They are making a difference. And what we don't want to have happen is that we go back to the way we were and we find ourselves falling back to even more restrictions. So get out, enjoy the sun, get out, do some landscaping or planting, go and buy flowers, go and buy seeds. But remember, the recommendations haven't changed. It's still physical distancing, it's wearing a mask because you care about others, and it's washing your hands. Okay. Yeah. So thanks for tuning in today. My message remains, and I continue to practice. Stay home, stay healthy, save lives, and wash your hands. Have a good day, enjoy the sun, and we'll talk to you tomorrow.